It is spreading across the U.S., and it's leading to all sorts of restrictions in some places. The CDC reported nearly 290,000 new cases of COVID-19 on Monday. That is the second highest number of daily new infections since the pandemic began. A final report released by the CDC today confirms COVID-19 was the nation's third leading cause of death last year. The U.S. has seen more than 810,000 COVID-related deaths since the start of the pandemic. More than half of those happened this year. Yesterday, President Biden announced a wide range of steps to slow the spread, including more testing. Nancy Chen reports.
This year was supposed to mark the return of the in-person New Year's Eve celebration here in Times Square, but that may not happen now. But the mayor expected to announce by the end of this week if people can gather after all. New statewide COVID cases have been topping 22,000 for several days now.
It's going to be a challenging few weeks. There's no question about it. We're seeing a big upsurge in cases.
Desperate to stop Omicron's spread, the nation's largest city announced new incentives.
We're announcing a $100 incentive for everyone who goes out and gets a booster here in New York City between now and the end of the year.
It's not just New York. Just over 30% of eligible Americans are boosted, as state officials across the country are pleading with the public to get their booster shots.
Don't put off getting your third dose, and we need to stop thinking about it as an optional dose.
In Israel, they're now recommending a fourth shot for anyone over 60. Peter Hotez is a professor of virology at the Baylor College of Medicine.
So if you're trying to keep the healthcare workforce in the healthcare workforce, we might need to look at giving that second booster as a way to temporarily, again, raise up your virus neutralizing antibodies and keep you in play.
Almost 40% of the population in the U.S. is still not vaccinated, and cities are hoping new restrictions will slow the spread. Atlanta will impose an indoor mask mandate regardless of vaccination status. Boston and Chicago will now require proof of vaccination for indoor settings like gyms and restaurants.
We didn't want to get to this point, but given the situation we find ourselves in, we simply have no choice.
And just days away from our second COVID Christmas, there are new concerns about airline labor shortages due to positive cases. In a letter Tuesday, Delta CEO asked the CDC to reduce the recommended quarantine time from 10 days to 5 for those who are vaccinated.
There are no changes to quarantine guidelines yet, but there is promising news. The FDA could grant emergency use authorization to COVID antiviral pills by Pfizer and Merck as early as today. They were found to be up to 88% effective if taken within 5 days of giving symptoms. However, health officials do say the key to getting through this pandemic is to get vaccinated, Anne-Marie.
Let's bring in Dr. Rajeev Fernando. He is a fellow in disaster medicine. He also specializes in infectious diseases. Thank you so much for joining us. So I have all sorts of things to ask you about. The first thing is going to be, what you make of Delta's CEO asking the CDC to reassess quarantine requirements for breakthrough infections amid concerns over the airline labor shortages. And so for him, it's about, not keeping people out when really they are healthy enough to work. But, for the rest of us, it's trying to understand how this virus works in this new environment where many, many people are vaccinated. We were told that 14 days is what you need to ensure that you're in the clear, but could a shorter quarantine period work?
That's a great question. Thank you for having me on the show. And firstly, at this point, we really don't know as much about the new strain. So I'd be a little bit cautious. I politely and respectfully disagree with the CEO of Delta. We can shorten the course once we know more about the Delta variant. Its infectiousness, we know. We also now know that COVID-19 can spread on flights twice that of not. So it is spreading on flights. So it's also very important to know at this point, until we know more about the variant, we should keep a proper quarantine. I politely disagree, and I'm in agreement with the CDC guidelines.
Earlier on CBS Mornings, Gayle King asked the CDC director about a top official's response to the Omicron variant. And I want to play some of that conversation.
We heard the president say one thing about we didn't see this coming. We heard you seem to say that, yeah, we sort of knew. So if we knew that this was coming, why are we not better prepared? The lines are very long. You can't get a home test these days. What happened?
Yeah. Good morning, Gail. So things are moving quickly, right? So about a week ago, we reported that we had about 3% of our sequences now representing Omicron, and now this week we're reporting up to 73%. So we've known about Omicron for a little less than a month now, and as we've been following it for the last several weeks, we have seen in countries that preceded us and other places doubling times of this virus of as quickly as 2 days or 1.5 days even. So as we started to learn about this just over the last couple of weeks, we have seen that what is happening here in the United States is mirrored what is happening in other countries. And that really was the motivation for the president's and the administration's work right now to increase surge capacity throughout hospitals, to increase capacity to do testing and access to testing, and then, of course, to increase access to vaccinations as well.
So what we're hearing a little bit is that there was an awareness of this variant, but perhaps it spread a little more rapidly than expected throughout this country. The response has been to make more tests available soon. That's the plan, is to make more tests available and to shore up the healthcare system. I want to ask you, what's your take on the president's plan thus far to combat the Omicron variant?
Sure. Firstly, let me say there is no way anyone could have predicted the spread of Omicron to this degree. Firstly, I'll tell you, the most infectious virus there is out there is measles, which means one person who has measles in a room, if they're unvaccinated, it can infect up to 18 people. Now, with the Omicron strain, one person, we don't have official data, but one person can infect more than 10 people. And that's why we see these rates go up from 3% all the way to 70%. Impossible to plan for something like this. The United States government did a travel ban when they heard about it, and it was simply impossible to predict this degree of infections. Now we're seeing the rates more than 295. I'm predicting these numbers are going to go higher. The United States is going to have a very, very difficult winter, at least 4 to 6 weeks. These tests are going to be spiking. It's very concerning. But right now, the most important thing we need to do is testing. I'm a little bit upset that we could have had more testing available. I'm in New York City. I'm working on a FEMA mission as a contractor, and we see people all the time. They're lining outside the buildings, going in curves and curves. That's concerning. So 500 million tests, which are going to be released to the public next month, is an appropriate measure. But I really wish we could have gotten those tests out earlier. Remember, Omicron has very mild symptoms. So people who come to me and call me and say, Dr. Fernando, I'm sure I have a cold. It's impossible to really say. Symptoms are so mild. They can be like a common cold. So it's very important to get testing done. We are getting them next month. Hopefully we'll get them a little bit sooner than that.
Let me ask you this about sort of widespread testing, because I remember sort of early on in the pandemic when tests were becoming available, the other component of testing was contact tracing. And then it seems like we just stopped talking about that. Are you concerned that, so we get all these tests out, and some people may test positive, may test negative. They may test negative or positive and stay home. They may not. But there's no follow through with these tests, no follow-up with these tests. Does that concern you? Or are you like, just get the tests out and at least let people know what their status is?
Yeah, that's a brilliant question. Earlier on, we focused a lot of contact tracing, and I still think it's very important right now, but just based on the mass scale of infections we're having at these numbers today, it is definitely going to top 300,000 infections tomorrow. It's simply impossible to conduct contact tracing in an optimal manner. When facilities are possible, I absolutely advocate for it, but I won't go against the government if they're not able to optimize this, the contact tracing. Simply getting a rapid test or a PCR is the best way to know. To get diagnosed is important. Quarantining is important. Contact tracing is going to be a little bit difficult at this point, but if you have the facility, I absolutely agree with that.
So listen, doctor, before I let you go, I just want some sort of basic advice. People are trying to figure out what to do as they gather. Some people have access to PCR tests. Some people won't. Some people are going to get the test, and then, 3 days later, they're going to travel across the country. They are going to be meeting with family members who don't agree with vaccines and haven't been vaccinated at all. Do you have sort of any general advice as we try to figure out just how to approach this second Christmas with COVID?
Sure, very troubling times. And for starters, I will say that the United States or Americans have missed out on many holidays. And that's why keeping mental hygiene in perspective is very important. Depression, anxiety, that could be worsened when you're supposed to meet family members for a Christmas event. So that's important to know that we should try to keep these events. Now, in addition to the CDC guidelines, my personal prerogative is actually to ask for a COVID test before you're going to an event. So if you're the host of an event, a Christmas event, ask people to get a test before you come in. It'll be respectful to everyone around. That's critical. And also ask them for their booster card. This is something we can do. If we can do this, we can definitely keep Americans safe during Christmas get-togethers. The other thing the CDC hasn't mentioned yet is a limitation on the number of people. So the number of people, when it's less, that actually constitutes a lesser risk, of course. Christmas parties, really consider, especially for immune-compromised people, consider this. Do you really need to go for the party? If you do need to go for it, go for it. But other events, let's say holiday parties at bars, restaurants, try to avoid those kind of things. It poses a higher risk. People, we don't know their vaccination status. So I try to avoid holiday parties, but family get-togethers, which is very important for mental hygiene, I promote. In addition to CDC, get a test before and show a vaccination card upon entrance.
All right, you heard it. After you pick up your turkey, it might be a good idea to pick up some rapid tests as well. You never know for your guests coming over. Dr. Fernando, thank you so much and happy holidays.
Thank you so much. Stay safe, America. Get boosted and get tested. Thank you.